My name is Jindong Tang. I have been working at the hematology lab at Dr. Chalmers Hospital in Fredericton since 2007. During this pandemic, I saw lots of my colleagues work really hard to fight the disease. And they have to deal with the personal lives, they have to deal with the stress, and have to come to work in a dangerous situation every day. But as we're working together with the healthcare workers, the essential workers, all the publics, and follow the government's guideline, we make our province the safest place in Canada for now. And we're lucky to live in here. Hope we can keep our social distance and wear the mask as needed and get our vaccine as quick as possible. And we can get our life back and travel freely, and we can have our summer vacation.
My name is Catherine Wong. I am an anesthesiologist at the Dr. Everett Chalmers Hospital here in Fredericton, New Brunswick. I'll tell you a little bit about my experience with COVID as a physician and also as a brand new mother. I left Toronto about 6 months before the pandemic hit because I was due to have my second child. And fortunately, in some ways, my daughter ended up coming early. So I delivered on March the 1st, and we were literally shut down about 10 days later here in Fredericton due to the COVID-19 epidemic. It was a stressful time, having had a new baby, having all the unknowns of COVID become real life. I remember being asked to be prepared to come back to work after having a one-week-old baby. We were so unsure about how this would unfold and who would get sick, how many physicians would we need to take care of all the patients who may or may not become coming to us, to the hospital. It was, to be honest, very overwhelming. We would get massive emails, about 100 emails a day on change in protocol, how to protect yourself. We don't have enough protective equipment. I'm really happy to see that our population is stepping up and doing their part in keeping in their bubbles, washing your hands whenever you can, avoid touching your face. I would strongly urge everyone to become immunized because, again, we are relying on each other to help prevent the spread of this disease or this infection.
Hi everyone, my name is Nancy Kang. I'm a family physician here in Fredericton, New Brunswick. Thankfully here in New Brunswick our case count has been very low throughout the pandemic, and so it hasn't had a huge impact day to day. I'm still able to see patients in the office, and when we do have outbreaks that gets changed to a lot of virtual appointments. I remember when the pandemic first started, one of our biggest concerns was personal protective equipment. You know, people saying that we weren't going to have enough and how are we going to distribute that. And so that was something that I worked towards with the medical community here in securing enough masks and gloves. And I do have to say the Chinese community here really stepped up during the early days, and you know, everybody in the community was buying masks from overseas if they could. If they had any at home from previous projects, they were donating them to the hospital, to family doctors that were still working in the community, to the emergency room physicians, and that was very, very greatly appreciated. We had retired moms sewing scrub caps and you know, scrub tops and everything for the medical workers here. So I'd like to say thank you very much to the Asian community for stepping up during.
我叫敏，我是和2个孩子一起在2019年8月来到佛兰的。有一个朋友介绍我去一个公寓楼做清洁工作，我去的时候，大楼很脏，因为已经好久没有人去打扫了。我接管了这个大楼清洁工作，我觉得它很重要，因为特别是在疫情期间，公共区域仍然要保持非常干净。这个不光光是让大家进出身心快乐，而且最重要的是要经常擦消毒，那么互相之间感染的几率就会减少。所以公共区域的洁净是非常重要的。 这也是为什么我一直坚持一直做这份工作，并且喜悦这份工作做到现在。我觉得疫情前我非常有感触的就是我们经常有 potluck party， 所以这是我很渴望的，希望疫情之后我们恢复 potluck party。
Hello, my name is Timothy, and I have been here living in Fredericton and in Canada for 25 years. My day job is working with the Canada Post as a letter carrier. And I know that throughout this past 2 years, everybody's having a rough times, and because during the pandemic especially, there's a lot of tension, physical alterations, racial tensions, and all that. As a late Asian Canadian, I haven't experienced any of that at all in Fredericton, so that's very lucky for me. I would like to encourage everyone to be more patient, having more empathy, helping everyone out in the community whenever possible, be kind. In the end of this, just want to say, looking forward, just like everyone, get vaccinated. Can go out and do other fun activities, whether it's travel, talking to your friends, doing some hiking, all the outdoor stuff. So I'm totally looking forward to that, and just want to finish saying thank you for everyone being cooperating, and stay safe.